This is a coronal section of liver with hemachromatosis and a section of normal liver for comparison. Although the hemachromatosis liver looks much smaller, this is an artifact of sectioning since this was through a smaller portion of the liver. Hemachromatosis is a disease characterized by diffuse iron deposition in various organs, including the liver, pancreas, and heart. Hemachromatosis may be hereditary or secondary, most commonly due to repeated blood transfusions, as in the treatment of hemolytic anemias. Normal total body iron ranges from 2 to 6 grams, with 0.5 grams stored in the liver, mostly in hepatocytes. With hemachromatosis, the total body iron may exceed 50 grams, of which 1/3 is stored in the liver. Consequences of this disease include cirrhosis, diabetes mellitus, and skin pigmentation. Grossly, this section of liver has a rusty brown color due to iron deposition. Although classic features of cirrhosis are not seen in this specimen, the liver parenchyma has a gritty, fibrotic texture due to the disease.